A health alert for you right now. March is Colorectal Cancer Awareness Month and a time to really think about getting yourself checked and tested to make sure you help prevent any diseases. Joining me right now, Dr. Christine Momenti, scientific advisor to the Colorectal Cancer Alliance, and Dee West, a colorectal cancer survivor. Ladies, thank you both for coming on and talking with us this morning. Dr. Momenti, let's talk with you first. Why is it so important for colorectal cancer screening and getting it done early? Because it really does save lives.
Colorectal cancer screening is absolutely critical. Colorectal cancer is now the second leading cause of cancer death among men under 50 in the United States, and it's the second leading cause of cancer death among women and men combined across the U.S. So our only way to prevent this disease is through screening, and that's through colonoscopy, which can remove precancerous polyps. And we can also detect this cancer early through home-based tests and stool-based tests. And this is important because if this disease is caught early, there's a 91% survival rate after 5 years. And we know that better survival is associated with better prognosis and quality of life following this disease.
All right, so are there obvious symptoms that you might have something that needs to be tested, or you could be totally asymptomatic, but you still, what is the age now you should be getting tested by?
Well, 45 is the new 50. A lot of people don't know that the screening age was lowered, and that's mainly because of this alarming increase of new cases under 50 in very young people. It's not so uncommon to see someone in their 20s and 30s diagnosed with this disease, and about 1 in 10 individuals are under 50. And so what we always say is that the #1 symptom is no symptom at all. So you could really be walking around and feeling like you're fine and healthy at the screening age, but you're not getting screened. And that's why we're here today with the Colorectal Cancer Alliance, to get people to the getscreened.org website to learn about your risk, learn about your screening options, and prevent this disease.
All right, let's talk to Dee here, because Dee, I know, can you share part of your story, how you were diagnosed, and what symptoms did you have that made you go and get tested?
Yeah, so in 2020, at the age of 51, I became really sick, and I was tired, weak, and really dizzy, and promised a family member I'd go get a physical. So I went, I saw my doctor, and based on my age, he recommended I get a colonoscopy. And so I had a colonoscopy a few months later, was incredibly surprised to learn that I had cancerous polyps. And I wish that I would have known the importance of screening. I wish I would have known that they had changed the screening age to 45. You know, I don't know how that would have changed the outcome, but I think I would have caught it earlier.
Well, we're glad you're here now for sure. I know we have just a few seconds left. We know you're passionate about recommending other folks what they can do. Where quickly can we point people to go to get those answers? Maybe just read up online.
Yeah, so there's 2 websites online. Colorectalcancer.org is a great resource for survivors, for family caretakers, whoever the family members. And then getscreened.org is the website where we want the listeners to go to today to look at their options for screening. But go get a colonoscopy. It gets a really bad rap, but I promise it's far easier than having a cancer diagnosis.
100%. We're glad you're with us, ladies. Thank you both for joining us. And yes, go get tested. All right, you guys have a good day. We got to take a break. We'll be right back.